Hello, my name is Jen Dykeshorn, and I'm excited to share with you the work that we've undertaken over the last 18 months to develop a conceptual framework for public mental health. Research and experience have identified a multitude of factors that are linked to public mental health. However, in order to build a strong evidence base for what works in public mental health practice, we must first understand the determinants and drivers of public mental health, how they relate to each other, and how or if they can be modified. The broad aim of this work package, therefore, is to create an overarching framework of public mental health across the life course, bringing together evidence from academic literature, from gray literature reports and policies, and also in consultation with practitioners and members of the public. We aim to create a comprehensive understanding of what drives public mental health. We also are working on a visual representation, hoping to create a tool that's useful for describing what public mental health means in a way that's useful for practitioners, policymakers, and members of the public. We conducted 3 different approaches simultaneously in order to create a comprehensive list of the determinants of public mental health, including a state-of-the-art review of published academic literature, gray literature review of policy documents and reports, and also doing some consultation and prioritization exercises with members of the public and also practitioners. So, what did we find? The state-of-the-art review identified a wide range of determinants that were consistently identified in the literature as relating to public mental health. This included age, gender, ethnicity, economic factors, and built environment, and many more. The review also looked at which frameworks were most commonly used to describe determinants of public mental health. The frameworks that were most commonly present in the literature included socio-ecological model as well as some resiliency-based models. We conducted scoping internet searches to find key governmental and non-governmental reports, policies, and guidance documents which discussed public mental health. We used forward citation tracking to identify any additional reports and then summarized the determinants identified. We found that there were many similar determinants as discussed in the academic literature. However, there were also some emerging determinants that had not been identified in the academic search. Our team of peer researchers also generated mind maps, which drew out the determinants of public mental health from their perspective. This was also repeated in public workshops with stakeholders to outline, again, what were the important factors to consider when talking about public mental health. As you can see from these diverse drawings, there's a very wide range of ways that people have conceptualized public mental health, and this exercise helped us identify some factors that were really important from the perspective of our peer researchers and members of the public that might not have appeared in our gray literature and academic literature searches. We conducted a series of in-person and online consultations with public health practitioners and members of the public. We had them try and answer the question, what does public mental health mean to you? And we also used an online modified Delphi process to try to prioritize which determinants were the most important and viewed to be modifiable through interventions. So to bring this all together, we have combined the information collected in the reviews, in the consultations and workshops in order to create a master list of determinants. Currently, we have 56 determinants organized across 4 domains: individual, family, community, and structural. In a moment, we'll be showing you this complete list when we open up a Padlet, which will be used to guide our discussion section. While we have completed a tremendous amount of work on this project already, there's still a very important piece to come. And in a moment, I will turn it over to Laura Fisher and Mylène Peterman, who will be discussing how we're trying to visualize the framework. But before we do so, we have a few moments for questions. Please do pop any questions you have in the chat and we will try to get to them before we move on with the session.